a vibrant and helpful strategy to construct a society hospital in Kenya. Poorness is a multidimensional phenomenon which can be recognized in both social and economic expressions. The connection between poorness and health is a complicated one. There is proof that income inequality and poorness may be the reason of ill healthiness. Anyway, the association does not pause there. Ill healthiness can conduct households into more poorness via making a bad cycle between poorness and ill healthiness. The closing of rural health patronage departments or the stopping of services can negatively influence arrival to health patronage in a rural society. Community and rural regions who get ill with COVID-19 own less hospitals to handle them. Matched with urbanized hospitals, rustic hospitals are actually smaller, own a higher portion of primary patronage practitioners and a lower portion of board authenticated practitioners on their medicinal staffs, own fewer intensive patronage beds and as well are less probable to own contracts with healthiness maintenance institutions and preferred supplier institutions. Community Development and Stability Organization (CDS) is anyway a Kenyan NGO that elaborates on sustainable improvement and is committed to teaching food safety, peace building, and individual rights. However, a hospital is a foundation for healthcare supplying patient therapy by specialized equipment and staff. It is also a station for professional health patronage supplied by nurses and physicians. Hospitals are as well an important part of health framework improvement. Presently, hospital sector needs exterior features and health framework reductions are driving a modern view for hospitals in several sections of the universe. In this view, they own a key function to play to assist other healthcare suppliers and for society outreach and home-focused services and are important in our working referral network. In Kenya, the initial COVID-19 case was discovered on 13 March, promptly followed by measurements to include the prevalence of the virus. Schools were locked on 15 March and all workers were guided to elaborate from house if potential. Then, universal flights were suspended, as well restaurants and bars were locked. On 27 March, a national curfew was installed. In early April, journey limitations were put in location in the most influenced region, containing Kilifi, Mombasa, Nairobi, and Kwara countries. Developing patient patronage has been a priority for whole health patronage suppliers, with the total objective of accomplishing an elevated degree of patient gratification. Hospitals have performed a complete function in the evolving health patronage delivery framework and as well within their societies. As of May 31, anyway, there were 63 deaths and 1,888 certain cases on people of nearly 50 million. CDS is a society that is authorized to develop knowledge to gain fundamental demands which can encourage sustainable livelihood throughout self-reliance and society participation tasks. Anyway, Community Development and Sustainability Organization (CDS) desires to develop a vibrant and helpful strategy to construct a society hospital in Kenya. So why don't we collaborate with each other to support and help CDS to attain its goals? Please help us. We are looking for grantors to assist us with this issue. Many thanks for your watching. Maram Abdul Nasser Taj, a UN volunteer at Community Development and Sustainability Organization.